Welcome to Talkin Business. I'm Joe Catrambone, CEO of the Stuart Martin County Chamber of Commerce, and it's my pleasure and honor today to have my dentist, Dr. Anthony DeLucia, with us as my guest. Doc, welcome. Thank you. Incidentally, you joined. I got here in 1989, and that's when you joined.
Yeah.
And I'll never forget the campaign that you ran in the newspaper. Barb was the one who picked it up. So in the Stuart News at the time, and I don't was your picture on it?
Yes.
Okay. Anyway, there's these in every couple of sections in the Stuart News. There was a picture of Doc, and it said, "I'm coming," or
No.
what did it say?
It was like it was a copying idea of missing children. It was like,
Yeah.
have you seen this person? You should.
Okay.
Dr. Anthony DeLucia, the gentle
I
dentist.
couldn't remember
Yeah.
what it was, but my wife picked up on it. She said, "Oh, look at this," and she was really impressed with it. In fact, I think she was one of your first patients.
Sure was.
So was I. So
Yep.
I still have my own teeth, thanks to Doc. He's been taking care of me since 1989. And at one time, didn't you advertise yourself as the painless dentist?
No, the gentle dentist.
Gentle dentist. That's right, and it's true. I've never had any real discomfort because I was not, as you probably remember, I was not in good shape when I came to see you with my teeth because I didn't go to dentists. I didn't like going to them. So anyway, you've been in. Was your first office in Stuart?
No, I actually started out in Dental Land up in Fort Pierce, the Orange Blossom Mall. I started out there, and that was 1987, September of 87. And then I found an office in Stuart where the dentist had to go out on disability. And no patients, so I took over the physical location.
Is that where you are now?
Yeah, no. Now
No, you were down on US 1.
Yes.
I remember on the corner there.
Correct, yeah. Across from the B&A Flea Market.
Yeah.
Yeah, that was the first office for about 8 years.
For 8 years you were there,
Yes.
and then you moved to your location now?
Yes.
That's more convenient for me.
Yeah. It's been a great location.
Yeah. So, did you grow up wanting to be a dentist, or what got you into the dentistry?
My mother used to kid around saying, "That's my son, the doctor." Around the age of 15, I changed it to dentist. So about 15, I decided to become a dentist. And,
I can picture your mother saying that.
And I just followed through on it.
So it's just like that.
Yeah.
Because your mother wanted a
I started
doctor,
out with Mom,
but
yes.
that's great. That's amazing. Do you have any? You have a couple of associates with you.
No,
Well,
by myself. No, I've never had associates.
no,
I've always
I
kept it
mean
by
like
myself.
a dental hygienist. And,
Yes.
Do all dentists have that now?
Yes. All dentists have hygienists to do most of the cleaning and the treatment, periodontal treatment of the patients.
So have you? Obviously, it's your choice to be by yourself rather than bringing
Correct.
associates. Is there a reason for that, or you just
More associates means more employees, bigger staff,
bigger headache?
more headaches. I have a wonderful staff,
You do have a great
smooth
staff.
running,
Yeah.
joy to be with,
Yeah.
and why rock the boat? Very happy with it.
How many patients you got?
Right now, I've got a couple of thousand active patients.
Nice.
Yeah, no complaints.
Yeah. So
People move. Unfortunately, some pass away. Always have new ones coming in.
do you get an influx of what's your average on new patients a month?
I'm seeing about 20 to 30 new patients a month.
Wow. So and how many you losing? What's the net gain on that 20?
I may be losing a few patients a month. I really keep track of that. I select the ones coming in.
So
Patients leaving, and usually when they leave, it's a problem with the insurance, or they move, or things like that.
what do most of your patients have insurance?
I think it's probably about 80%.
80%?
But the insurance is becoming more and more useless.
Yeah. Oh, I've had it for years, and I know there's some things it doesn't cover, but it doesn't cover cosmetics, obviously, right?
Correct.
But most other things,
Yeah.
at least the one I've got, I do. I don't. Occasionally, I have to write you a check, but most times my insurance covers what you do.
Yeah. The problem with the insurance is it's been the same $1,000, $1,500, $2,000 a year coverage for the last 25 years. But fees have gone up considerably in the last 25 years. So if insurance used to go a lot further years ago than it does go now.
Yeah. And you're not advertising anymore, right?
No, I have on
So,
the website, I have a wonderful company that does a lot of, what do you call it, SEO, optimization. So if you Google my name or certain scenarios like emergency dentist or cosmetic dentistry or sedation dentistry or things like that, I should come up within hopefully the first 5 or 8 on Google. But it's all through Google. That's it. But I don't do no other advertising. That's it.
what changes? How long you been a dentist?
38 years now. Goes by fast.
Unbelievable.
Yeah.
So what do you think the most radical changes you've seen in the industry, and what do you foresee coming forward in the future?
The most radical changes are the advances in technology. Where we used to just have an X-ray that gives us a two-dimensional image, we can do what's called a CT scan, which they've been around for a while. Now using CT scans in dentistry has greatly improved the diagnostic capability and picking up on a lot more that we would have missed in a regular two-dimensional X-ray.
So exactly what is that?
It's just like when
like
you
is
get
it
a
an
CT scan of
X-ray
the
or-
body, it's a three-dimensional X-ray. Okay? For example, in the regular
think
X-ray,
you've done
you
that
can
on
just
me.
see this. From the CT scan, you can see this. All different sizes.
I got you.
Okay, so just like when we do CT scan of other parts of the body, the CT scan of the mouth has really helped with the diagnostic capability and pick up a lot more fractures in teeth, abscesses. Okay, also when placing dental implants, there are certain areas of the mouth you have to watch out for the sinus in the upper arch. You have to watch out for a nerve in the lower jaw. Okay, you want to make sure you stay clear of that. With a CT scan, you can make sure you know exactly where that nerve is. Okay.
So you look at that while you're performing whatever you're doing?
Initially, but now we also have a 3D scanner in the mouth, so you can run with a kind of like a 3D camera. You can run a scan of the mouth and have a three-dimensional image of the jaw. And between the 3D scan and the CT scan, you plan out implant placement on the computer, and then with the combination of the two, you can make a surgical guide. So you have the implant placed within a millimeter of exactly where you want it to be. That's been the latest advances in,
That's amazing.
advancements in dentistry. I mean, implant placement has helped out tremendously. Other things now are also going to milled zirconium crowns.
What
are a lot
kind of crowns?
Zirconium. So it used to be the strong crowns were porcelain fused to metal. Okay. Now the solid milling from a solid piece of zirconium is much stronger. And between taking a scan of the mouth rather than the gooey impression, okay, and sending that scan electronically to the lab and designing the crown online.
You
Okay,
actually
and
design it?
Yeah, the crowns, I don't design it, my lab tech does, but they design the crown on the computer, mill it out of a solid piece of zirconium with, I guess you call it a CNC machine, and then the accuracy is amazing. And no more gooey impressions, and it's really come a long way that way.
That was a hassle impression,
Oh, yeah.
wasn't it?
Oh, yeah.
You bite
Patients
down
gagging and all, and
Oh,
no,
yeah.
no more of that.
Technology. What do you see? Is there anything that you could see that they're they're trying to implement now that's going to even improve?
Well, we're going to now. They're already out there, but I'm not too impressed by it yet. Doing patients who don't have any teeth.
Don't have what?
People that don't have any teeth. We call them
Okay.
edentulous. Okay, who are wearing dentures. Those that can afford it replace the implants to hold the teeth in place, but a lot cannot afford that. So what we're doing is scanning both the arch, scan the mouth to make a denture, and then doing a denture made out of 3D printing a denture.
3D printer.
Yeah, and using 3D printing and dentistry for dentures.
Are you able to do that, or you send it out?
I've done a couple. I'm still on the fence with that.
Yeah.
But now you can have things like that in the office. Again, having a small office. I'd rather have the lab have all the fancy equipment, and I just work with the local labs.
Yeah. Well,
Yeah.
yeah. You don't have to buy the equipment. You don't have
Exactly.
to maintain it. And you have to go.
Yeah.
Do you? Do you have a lot of patients that have implants, and how do you, if someone has implants, or let's say a denture,
Yeah.
what do they come back to you for?
At least once a year, should come back
Have
just
them
to have the
cleaned?
dentures cleaned and just check the gums, make sure there's no growths or anything like that. Every patient always gets an oral cancer screening at every recall visit, every hygiene visit. Okay, so he's doing oral cancer screening and just to check the fit of the dentures. Over time, dentures may loosen up, and you do what's called a reline to help them fit better. Or sometimes dentures just worn out and they need to be replaced.
How's the is it an implant where you drill in, and is that an implant?
Yes, implants are they're screws, actually titanium screws that we screw into the jawbone, and they provide anchorage for either teeth or denture.
So what's it leave, like a stud?
Yes, so the
And then you
implant goes
build
to the
the-
jawbone. Yeah,
And then you build the tooth around that stud?
you have an abutment that goes into the implant. Okay, and that's what sticks out of the gums, and then you build on top of that, depending on which restoration you go with. It could be a crown, it could be a bridge, it could be a denture. It could be a for people who have full mouth of implants, a fixed, I want to say a fixed denture, but yeah, like a fixed denture in the mouth,
Do
and fixed teeth.
do people still do bridges?
Yes.
Is that a big part of dentistry today?
Yeah,
or-
some people are still fearful of implants. They don't have the bone for the implants, don't have the finances for the implants, and so a bridge is still a viable option.
I can't imagine him. I can't imagine having a bridge. You know, you don't feel the roof of your mouth, obviously.
Okay,
right?
well, that's a denture.
Oh, that's
Okay, so denture covers the roof of your mouth.
okay. So what's
A
the bridge?
if you have 3 teeth in a row
Yeah,
and you're missing one in the middle,
yeah.
you crown the tooth before and after the empty space, and
Okay.
you're bridging the gap.
Okay,
That's fixed in your mouth. Does not cover the roof of your mouth. It pretty
okay,
much feels the same way the teeth did before.
okay.
Okay.
I think I have them. I think you may have done one or two on me. But so what is the one that covers the roof of your mouth?
That's a denture.
A denture. Okay.
Yes.
So that's a fixed object with teeth in it,
Yeah.
and you just stick it up in your mouth. And
Yeah.
It fills in
And
the.
it covers the roof of your mouth to provide suction to help it stay in place.
I see it advertised. Don't they sell stuff that
Yeah. Yeah. There's Fix-A-Dent. There's Polygrip. There's
Polygrip? Yeah.
Yeah.
Where,
yeah.
so your teeth
Gluing
don't,
them in. Yes. So they don't move.
don't fall out while you're talking. What's your typical? As most of your patients are scheduled for whatever, just oral hygiene. What percentage do you have? I know you take emergency if somebody's got
Yeah.
what percentage of your patients are just on a schedule that come in once every 3 months or every 6 months? Is that the majority of your, rather than just walk-ins?
I don't keep track of the numbers, but yeah, the idea is to have everybody coming back in every 6 months minimum.
Yeah.
And if they have some history of gum disease, every 3 to 6 months. Okay. And, patients come in for cleanings. There's a couple of things. Number one, helps them maintain their teeth. Helps them come in to diagnose any kind of pathology, any kind of decay, any other dentistry that's needed. And it's pretty much, if they've had a lot of dentistry done, to protect their investment, to make sure it's properly maintained.
What with children? What if your patient has a child? What is your recommendation that how often should that child come back for an exam?
Okay.
Say starting when they start school, 5 years old.
Okay.
Now most of them don't have permanent teeth by that time, do they?
No. So, as far as with children, children should come in starting about 2.5 to 3 years old for the first visit.
Really?
Yes, but prior to that, your oral hygiene starts at home. So just as the teeth start erupting, and the rule is 4 teeth every 4 months, beginning at 7 months. That's
Say
rule
that
number one.
again?
4 teeth
Yeah.
every 4 months,
Yeah.
starting at 7 months.
Okay. Oh, really?
That's rule number one. Rule number two is there can be any variation of that. Okay, some may not get the teeth until at least a year old. Okay, it doesn't matter. Okay, but the big thing is as the teeth start erupting, the parent should have one of those little baby toothbrushes and get them used to them going in there and scrubbing their gums and scrubbing the teeth. That's the most important thing. Okay, so by 2.5 to 3 years old, even if they want to do it themselves, that's fine, but then the parents got to go in after and make sure they're brushed thoroughly. Next most important thing is their diet, okay? Coke, Pepsi, Mountain Dew, Gatorade, Powerade is absolutely horrendous on teeth. Okay, there's acids in there, there's sugars in there, it is just not good for teeth. Okay, children should avoid any of that, at least past the age of 4 or 5 years old. Okay, until you actually get in the habit of brushing the teeth. But at 2.5 to 3 years old, the child should come in for a cleaning. Okay, and we make it fun. Okay, we're coming in to count teeth. Okay, then we're going to tickle the teeth as we're polishing the teeth, and get them used to it. In my office, I do see children, and the first visit's got to be fun. And
Yes.
if they start getting upset, abort and reschedule, and bring them back, because dentists create dental phobics. No one's born being a dental phobic. Okay, dentists create dental phobics.
Huh. That's never thought of that, but of course that makes
Yeah.
sense. Yeah. What's the youngest patient you've ever?
No, 2.5 to 3 years old.
2.5.
Yeah.
Do they? How do they? I mean, is there a fear there, or is it, like you say, you have to create a good
Yes.
atmosphere for them? But just ordinarily, just instinctively, are they scared or they
It
worried?
depends on the approach of getting them in. Okay. First, we're going to go for a ride. You put them in the chair and take them up and down the chair. Then we're going to lay you back like an astronaut. Okay. Then you open up your mouth wide like a big alligator. You're going to count teeth. Okay. And just kind of see how it is. Okay. If they're cooperating with that, then you go a little bit further. Okay. Have them laying back and get a mirror, look around. Okay. That's going well. Then see if we can tickle their teeth. Okay. And sometimes, anything go near their mouth, so you take the actual prophy cup and just kind of touch their finger with it and say, this is soft. Okay? And again, little by little, any kind of resistance, any kind of upset, just stop. Okay? I mean, now, pedodontists who specialize in treating children, okay, I get to pick and choose only the perfect kids. All right? Sometimes kids, they have to have the teeth cleaned, they have to have some dental treatment done. That's the pedodontist. They're better dealing with that than I am. But,
I was going to say that
Yeah.
would have to take a lot of patience.
oh yeah. Sometimes kids cry and all, but I mean, certain things have to be done. But in my office, either kids happy or, if not, local pedodontist.
Do dentists still use? I don't know. I used to
Nitrous.
call it happy
Laughing
gas.
gas, yeah.
You still use that?
Oh yeah. No, I still have it.
That is
I would use it
amazing.
on kids. Okay, on children, I either want them completely just
You don't
fully
use
alert.
it on kids?
No,
Okay.
no, nothing wrong with it, but I
Yeah.
just would rather not. But yeah, I saw it on adults. Well, you know, they just kind of relax and takes the edge
You know,
off.
I've had it. You know, you don't. I mean, you don't care to put your foot in your mouth. You know, that is some. That is some. That is some powerful stuff.
It doesn't sedate everybody that well.
No,
Some people just takes the edge off. Some people it really completely relaxes them.
Yeah, that's what it does to
But,
me. I get a kick out of their commercial on TV where the kid had his tooth pulled and the mother's driving him home and the kid is, I guess, still under the,
Oh.
you know, and they're like out in space. My nose is over here or stuff.
Yeah.
That's a funny commercial. But yeah, that it's totally, and I think I know you've used it on me, and it's just but I mean if it's nothing, you know, if it's anything big deal,
Yeah.
the shot usually
Yeah, local
takes
injection.
care of
No.
it. Yeah,
Yeah,
Novocaine,
that's,
right?
yeah, Novocaine. Well, it's kind of known as Novocaine, but yes, local injection. There's different ones that we use.
Yeah, it numbs
But, yeah.
everything up. Then
I've developed a technique that I can never say a painless injection, but minimizes discomfort with injections.
yeah, for sure. Yeah, and yeah. In fact, I don't. I mean, I don't do it anymore.
Yeah.
But I used to want a shot for drilling.
Yeah. Yeah.
We're winding down. Is there anything we missed that you want to talk about, or that you want your viewers, the patients, to know that
No.
we haven't covered?
Let's see. I'm always welcoming new patients. There's always new patients welcome. All my patients get my personal cell phone number. So if they have an emergency over the weekend or at least get a hold of me, they have full access to me.
That's true. I
And,
can
yeah.
verify that.
And yeah, and that's never been a problem. I've kept my office small. I call it a small boutique practice with state-of-the-art technology. And even though it's 38 years, I'm in no hurry to retire. I just plan to keep going.
Well, thanks, Doc. Appreciate you taking the time to come and visit.
Thank you.
Thank you.